Welcome to AFMC TV. I'm Robin Linder.
The goal of that is to maximize people's quality of life, right?
You want to make sure that your housing is affordable in your community.
We have to think about vaccines in a way that we haven't thought about them before.
I had a lot of the legislative adults who were very creative.
Down on the floor and play with their kids.
AFMC TV, thanks for watching. Have a great day. Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Chrystal Fullen. She's a clinical neuropsychologist at UAMS and Baptist Health Rehabilitation Institute. Dr. Fullen, thanks for being here today.
Thank you so much for having me, Robin.
So can you start by sharing what a clinical neuropsychologist does?
Yeah, sure. So a clinical neuropsychologist is much like a normal psychologist, traditional psychologist, with a couple of exceptions. So clinical neuropsychologists have additional training in the central nervous system, so the brain and the spinal cord. And while most psychologists focus in on things like therapy or intervention, neuropsychologists focus in on assessment. And so our job is to actually assess or test the brain. So we actually quantify cognition. So we can test how someone's memory works, how their language skills look, what their attention span is like, and use that information to help figure out if there's been a change in their cognitive abilities, or help with some treatment planning if we know they've had something like a brain injury or a stroke, and we want to figure out what they still do well, what they might need some support with. And so that's kind of clinical neuropsychology, a little bit of a snapshot. We're more assessors of brain functioning. When we do intervention, one of the things we tend to do is rehab cognitive abilities. So for example, we might do an evaluation and find that someone has these sets of strengths and these sets of weaknesses. We might use those strengths to help offset those weaknesses by teaching people compensatory strategies to have a better quality of life.
And tell us about your work with Thrive. It has been gaining some attention. What is it and who does it serve?
Yeah, Thrive is so wonderful. It's been so well received by the Arkansas population and community. It is essentially a brain injury workshop. It's not a support group. It is a treatment. It's an intervention. And it's an intervention that really focuses in on helping people overcome some of the challenges that can be most interfering in getting back to their lives after something like a brain injury, in particular a traumatic brain injury or TBI. So Thrive includes things like cognitive rehabilitation when we're sort of rehabbing those cognitive abilities. It also includes adjustment to injury counseling and psychological strategies to help people improve their emotional wellness. It includes education. So a lot of times after something like a brain injury or a stroke, there's so much information out there, right? So we really kind of help people focus in on the information that's most important for them to know and most relevant for them, and how to get them connected to other people in the community that they need to be connected with, mostly medical providers and services. And then last but not least, Thrive also has a magic ingredient, and that's our peer support mentors. We have wonderful peer support mentors who are survivors of brain injury, who've had additional training through us, and they mentor people who come into Thrive so that they can work one-on-one with someone who might be newly injured and who might really need to kind of hear from someone with lived experience.
And what makes Thrive's approach unique compared to, say, traditional models of care?
Yeah, so I think one of the most unique things is that while all of these services are available in the community, they're not always available together. And for some communities, because Arkansas is quite rural, they might not be available at all. And so Thrive sort of puts everything together. It puts cog rehab together. It puts counseling together. It puts education and access to multiple community providers that are experts in their field. And it includes that peer support component. Plus, all of this is done in a group setting. So people have the opportunity to practice the skills that they're learning and get that immediate feedback from the group who are also there and also going through maybe not the same thing, but similar things. So it's kind of a whole package.
And what kinds of challenges do you most often see in the patients that you work with?
Yeah, I think it's such an interesting question because there are a lot of different things that we see. I think sometimes it depends on the day that you ask me, but for the most part, one of the things I always like to say is because every brain is different, every brain injury is different. So let's say two people have the same type of stroke in the same place in the brain. We're absolutely going to see common symptoms across those two people, but we're also going to see unique differences because those people are coming in with their unique background. So they may actually have different challenges and different relative strengths. I think what I'll probably say today is one of the things that tend to be a challenge across the board, regardless of the type of brain injury that people have experienced, is that adjustment to injury piece. I think everyone expects immediately after an injury for people to struggle a little bit with adjustment, right? To struggle with a new set of skills, to struggle with grief over things that they may have lost or new symptoms that are really challenging or difficult and need time to work through that. So we call that adjustment to injury or adjustment to diagnosis. Let's say if someone has a diagnosis that we know is going to impact their cognitive skills, like maybe MS. I think the thing that's the big challenge is that sometimes people will go through the initial adjustment to injury, but then maybe 2 years later or 5 years later, kind of go through it again. The brain has this really great ability to get really used to a certain type of environment, a certain level of pressure. And sometimes when that changes, some of those adjustment to injury symptoms can come back. So let's say someone is injured and maybe they go back to work and they're doing really well. But then maybe they get a new position or something like that, right? And it's a new environment with new pressures. They might sort of recognize or realize that there is a skill that they've lost that they didn't realize they'd lost before, or they might just need a little bit extra time to transition to something, and it's hard to give ourselves that time to transition to things. So usually we want things now and we want results now, and so sometimes adjustment to injury and that grief associated with things we've lost after injury can come up again down the line, and I think that could be a really big challenge because it feels like, you have to go through it again.
And how can early identification and intervention change outcomes for patients and families?
Yeah, I think that is huge, especially with traumatic brain injury, but really any type of brain injury. The sooner we know that something has happened, the sooner we can start assessing and addressing the things that are associated with that injury. With traumatic brain injury, with stroke, we have what we call like this negative accelerating recovery curve. I think that's how they refer to it. But what it means basically is the fact that right after your injury, when you have a brain injury, you're going to have the most recovery, like lots of recovery really quickly. Over time, you'll still have recovery, but how much will slowly kind of decrease over time. And this is natural recovery, right? If you pair those initial days, months, weeks with rehab, you have sort of this boost in your recovery from rehab paired with your natural recovery. So you have more recovery, like bandwidth earlier on. If we only identify and start getting treatment down the line, we've missed sort of boosting those early days where we naturally are going to have more recovery. You'll still have recovery, so it's important to get help at any period of time, but those early days are really, really vital.
And tell us about community partnerships with Thrive. They're very important. Like, how do providers, local partners kind of fit into the mission?
Oh, that is actually, I think, one of the big reasons why Thrive has been the success that it's been. Thrive in particular, the education component of Thrive relies on other community providers, experts to come in and share what they know, and also share with our participants or in that group how to get in touch with them or people like them in the future. So, for example, we'll have speech therapy come and chat to us about what they do and how that can help after a brain injury. We have yoga therapists come in. We have animal-assisted therapy. We have PM&R doctors. We have life coaches. We have counselors. We have trauma psychologists. So we have all of these wonderful people who come in, share what they know, and then help people get connected to people like them or to them in the community, which can make things so much more simpler. It's so hard to find services, find providers, and so they kind of simplify that process. And then, of course, we have the peers, as I mentioned. So we have these peer support mentors who are the magic ingredient in Thrive 100%, who volunteer their time, do the extra training, and then are there for the participants as accountability partners, as mentors. They provide advice, they share. They help with some of the just mapping out of what would or would not work, given the fact that they've had this lived experience. And then, of course, last but not least, we have the UAMS Brain Injury Program, who has provided administrative support and really shared the program across the state for anybody who survived a traumatic brain injury and their families, that people can have awareness that we have this free resource. It is also a free resource, which is amazing, for people in the state. So those are just some of the community partnerships. Of course, I've had residents and colleagues as well that have helped me along the way, but Thrive works because of the community, and I think that's how it works for the community.
And for healthcare providers who may not specialize in neuropsychology, what's the one thing they should know to better support their patients?
Oh, wow. Can I do two things?
Sure.
I think the biggest thing is just to kind of remember that the brain controls everything, right? Everything we do. So us speaking right now, my hand movements, me thinking through how I'm going to answer your questions, all of that is the brain. And so after any kind of brain injury, I think our expectations for people can sometimes be a little bit unwieldy. For example, length of appointments, how brightly our offices are lit, how quickly we speak. After brain injuries, brains are working so hard in order to maintain the status quo, do what is needed, and might be working a little bit differently. And that means that the brain can get overstimulated really quickly. So I think being willing to adapt how we do things to better meet the needs of people who've survived a brain injury because of some of that overstimulation is one super important thing. I think the second super important thing has to do with emotions and like the psychology of it all. I think a lot of times when we talk about emotions, we talk about them like they come from the heart, right? But the heart is just pumping blood through the body. Our emotions, how we react to things, how we control our emotions, that's all brain-based. So it's actually a skill. And so sometimes after brain injury, people can struggle with emotional control. They can struggle processing through their emotions. They can struggle with these things. And it's not a separate psychological problem. It's a brain-based problem and connected to that brain injury. So I think sometimes we'll think about, being able to like control our emotions is something that's easy to do. It's not easy to do. It's a privilege. It's a skill that our brain affords us. So kind of just remembering those things.
So important. So one last question. Looking ahead, what's your vision for the future of the Thrive program, programs like this in Arkansas?
Yeah, I mean, we want to share Thrive and just honestly have it be available in so many different settings. We'd love to collaborate and make Thrive something that can be seen for the pediatric population. Last year, one of my residents worked on a companion caregiver workshop for caregivers specifically so that they could receive education and support and focus on caregiver wellness. So more companion programs. We have a new partnership with Baptist Health Rehab Institute as well. They'll be hosting Thrive moving forward, and I'm really excited about that. They are pretty much the only CARF-accredited acute rehab center in Arkansas. So they're great at rehab and they have a wonderful team. So they'll be helping us with Thrive too. So I think that'll really look interesting, and there might be opportunities to do an inpatient Thrive workshop as well. So just continuing to expand what we do. Typically, every year we make changes based on research, try to update things to stay really abreast of everything new that comes out, so we can give the folks in Arkansas the best possible treatment that we have available. And so I think just continuing to kind of stay true to that and continuing to grow is going to be good. We are doing a rewrite of our manual right now because we've had some new research come out about building insight after injury, how to help with memory after injury, and then also some stuff about building confidence after injury that we're gonna integrate. And because there's so much that's happened, and we had the new caregiver workshop happen last year, we're actually rebranding, and we even have a new name we're gonna launch. It's very exciting. So keep watching that space because all of that's coming in the future. So we're excited.
And when will the handbook be released, these updates be released? Is that something that public or providers can find online?
Yeah, so everything will come October 15th. That's the date of our new workshop. And so around that date, we'll have everything released, and we'll have all that information online as well. The brain injury program will still have our main website for a while. So you can check with the brain injury program at UAMS to see any updates about Thrive.
Well, Dr. Fullen, thank you so much for sharing this important information. It's so interesting, and I look forward to seeing updates and hearing about them in October.
Thank you so much.
And that's it for this episode of AFMC TV. Have a great day, and thanks for watching.